Hello, and thank you for joining me for part 2 of today's seminar, where we'll be discussing injection techniques for local anesthesia. Today we have Kevin and Drew with us. For today's demonstrations, we'll be using a safety needle with a ball protector on the tip. This will help us highlight our sites of insertion. Our objectives for today's technique review are as follows. First, we'll review the basic maxillary injection techniques, including the posterior superior alveolar nerve block, or PSA, the middle superior alveolar nerve block, or the MSA, the anterior superior alveolar nerve block, or ASA, and we'll finish off with the greater palatine block. We'll continue our review by looking at the mandibular injection techniques, specifically the mental, inferior alveolar, and lingual nerve blocks. Each technique will include a brief summary, including the type of needle that should be used, the associated anatomical landmarks, the recommended depth of needle penetration, and any other special instructions. And remember, it's important to aspirate before every injection to ensure safe needle placement. Let's go ahead and get started. Your anatomical landmarks for performing the PSA are the maxillary tuberosity and the height of the vestibule. Your orientation should be in a posterior, superior, and medial direction as seen on the screen. Your insertion point should be slightly medial to the maxillary tuberosity. The recommended needle length for this injection is a short 25 millimeter needle. It's important to note that a longer needle increases the risk for accidental intravascular injection due to close proximity of large vascular structures such as the pterygoid plexus. Your anatomical landmarks for performing the MSA are the apex of the maxillary second premolar and the height of the vestibule. Be careful not to inject directly into a frenum attachment. The recommended needle length for this injection is a short 25 millimeter needle, and your depth of penetration should never exceed 1/2 of the needle's total length. The intraoral anatomical landmarks for the ASA are the middle of the canine and the height of the vestibule. The infraorbital notch serves as a directional target you can orient your needle towards and can be palpated extraorally. Never insert the needle in an attempt to reach the infraorbital notch. The notch is not your target. The recommended needle length for this injection is a short 25 millimeter needle, and your depth of penetration should never exceed 1/2 of the needle's total length. The landmarks for the greater palatine nerve block are the border between the hard and soft palates and the maxillary second molar. This is typically where the greater palatine foramen is found, and your insertion site should be 2 to 3 millimeters anterior to the assumed location of the foramen. Gentle pressure applied with a cotton-tipped applicator, along with slow delivery, provides a more comfortable experience for the patient during needle insertion. A short 25 millimeter needle, along with minimal depth of penetration, are recommended to avoid trauma and subperiosteal delivery. The mental foramen can sometimes be palpated both extraorally and intraorally, and is typically located between the apices of the first and second mandibular premolars. The first and second mandibular premolars, along with the depth of the vestibule, serve as the anatomical landmarks for this injection. It is critical to avoid inserting the needle directly over the mental foramen. Doing so may cause permanent injury to the nerve tissue found therein. There are several key anatomical landmarks for the IA. The first can be seen by asking the patient to open as wide as they can. This structure is known as the pterygomandibular raphe. The second set of landmarks are the contralateral first and second mandibular premolars. The premolars serve as a site through which you will direct your syringe and needle assembly toward the site of needle insertion. One technique for administering the IA is to rest the thumb of your non-dominant hand against the ascending ramus. The middle and ring fingers of the same hand should rest against the angle of the mandible on the outside of the patient's mouth. Approach the insertion site from the direction of the contralateral mandibular first and second premolars. The insertion site should be at or slightly above the mandibular plane of occlusion. Take care not to penetrate the pterygomandibular raphe during insertion. It is strongly recommended to only use long needles when administering the IA. Smaller gauge needles are at higher risk of overinsertion and breakage due to their shorter length and smaller diameter. Always aspirate prior to delivering a complete dose on an IA block. The depth of the needle penetration should never exceed 1/2 to 2/3 the total length of the needle. Always take care not to insert the needle all the way to the hub. The lingual nerve can be anesthetized by delivering anesthetic solution as the needle is being retracted from an IA block. I hope you found this information helpful. Thank you for joining me.